Hi, everyone, and welcome back to Field of Vision with Nikki D. And if you're listening to this episode, there's a good chance you've recently heard the words, you have glaucoma. And if that's the case, you might be feeling a mix of emotions right now, maybe some confusion, anxiety, maybe even fear about what the future might look like. So today, we're going to talk about something very simple but very important. What actually happens after you get that glaucoma diagnosis? What should you expect? What will your doctor be monitoring? And how do you move forward without letting fear take over? All right, so first off, take a breath. The first thing I want to say is something that many people wish they had heard immediately after their diagnosis. In most cases, not all, but most cases, glaucoma is not an emergency. There are some instances where glaucoma, closed angle glaucoma, can be emergent. So you don't want to mess around with that. But if you have open angle glaucoma, typically, most of the time, that is something that is slower moving. Many people hear the word glaucoma and immediately think about blindness or rapid vision loss. But the reality is most forms of glaucoma, especially open angle glaucoma, tend to progress slowly. That means your doctors are looking at patterns over time, not just one appointment or one number. So if you've just been diagnosed, the first step is actually very simple. Take a breath. You have time to learn about the condition and work with your doctor on a care plan. So, what happens after you've been diagnosed? Usually, after a glaucoma diagnosis, your doctor will begin building a baseline of information about your eyes. This baseline helps them monitor changes over time and determine how your glaucoma behaves. That's why you may notice several different tests during your visits. And if you're newly diagnosed, these tests can feel a little bit overwhelming at first. I know they did for me. I felt like I was spending hours at my doctor's office. So let's walk through what typically happens during glaucoma appointments. So, one of the biggest sources of anxiety for newly diagnosed patients is simply not knowing what all the machines and tests are doing. Some of these machines are quite big, and a lot of times the doctor is not really giving a lot of information out to you. You walk into the appointment wondering, what are they checking today? What do these numbers mean? What happens if something changes? So let's talk about the most common parts of your first glaucoma visits. So first off, they're going to check your eye pressure, IOP, or interocular pressure. Almost every visit begins with a pressure check. This measures the pressure inside your eye, which is called intraocular pressure or IOP. Sometimes this is done with a quick puff of air test. Other times, though, a small device gently touches the eye after they put numbing drops in. You're not going to feel anything, I promise. This number is important because pressure is one of the biggest factors that can affect optic nerve. But something very important to remember is that one pressure reading does not tell the whole story. Pressures naturally fluctuate during the day. So your doctor is looking at trends over time, not reacting to one single number. Another test called the optic nerve imaging or OCT is another part of your glaucoma care, and that will also monitor the health of your optic nerve. Glaucoma affects the optic nerve over time, and doctors use imaging tools to watch for subtle changes. One of the most common scans is called the OCT scan, which stands for optical coherence tomography. It's a quick, painless scan that creates a detailed image of the optic nerve and surrounding nerve fiber layers. So during the test, you simply look at a target in front of you while the machine captures the images. Super simple, super easy. It's quick and it doesn't hurt at all. The most important thing to know is that these scans are compared over time. Doctors are looking for patterns and trends rather than reacting to tiny differences between scans. Another test many glaucoma patients become familiar with is called the visual field test. This test measures your peripheral vision, so the vision from the outside, right? Because as you may or may not know, glaucoma starts to affect the outside vision, the peripheral vision, and can close in over time. This is the outer edges of your vision. So during the test, you look into a dome-shaped machine and you press a button whenever you see a small light appear. So typically what they do is they'll put something over the other eye, and they're going to test one eye at a time, and you stare into the machine, you stare at the light in front of you, you don't move your eye around, you just stare at the light. They give you a little remote, and every time you see a light flash, you press a button. Many patients hate this test. It doesn't hurt at all. It does take a couple minutes, sometimes 5 to 7 minutes, sometimes longer. But it's a very important test. For many people, this test can feel stressful the first few times because you want to perform perfectly. But there's something very important to understand. Doctors expect variability in this test. They're looking at patterns, again, across multiple tests and over time. So it's not how perfect you can perform this test, okay? So if you feel like you've missed a few lights, had trouble concentrating, that's totally normal, and that does not mean something bad is happening. It simply becomes part of a bigger picture your doctor is monitoring, and again, it's happening over time. Once your doctor understands your baseline, the next step is usually management. So for many people, treatment can begin with prescription eye drops. These are designed to lower your intraocular pressure or your eye pressure, your IOP, and lowering pressure helps reduce the stress on the optic nerve. In some cases, doctors may recommend laser procedures or other treatments depending on the type of glaucoma and how it responds to therapy. And we'll talk about those in future episodes. But for many patients, glaucoma management simply becomes part of the daily routine. Using prescribed drops, keeping regular appointments, monitoring the condition over time. Many people manage glaucoma successfully by doing these things for decades. So something that isn't talked about much or enough really, is the emotional side of glaucoma. Because glaucoma is invisible to most people. You look very normal from the outside. People are not really knowing what's going on with your eyes. They don't realize what you're carrying on the inside, all this stress, this worry. You might look completely fine, but internally you're processing a diagnosis involving your vision, which can feel really heavy. And you may ask yourself, will my vision change? How serious is this? What does my future look like? Those questions are totally normal. And one of the goals of this podcast is to create a space where those questions can be talked about openly and calmly, because information helps reduce fear. The right information helps reduce fear. So what helped me? So over the years, a few things helped me feel more grounded in managing my glaucoma. So the first was learning about the condition from reliable sources. So understanding what glaucoma actually is and what it isn't can make a big difference. So make sure you're getting information from reliable sources. I love support groups, and those are great, but sometimes those support groups can have a lot of fear in them, and that can just only increase your fear and your anxiety. The second was focusing on long-term trends rather than individual numbers. So remember, your eye pressure will fluctuate. It fluctuates daily. Tests will vary. Your doctor looks at patterns across time. And the third was realizing that glaucoma management is something many people live with successfully for decades. So I've had glaucoma for over 25 years. I lead a very active life. I do yoga. I strength train. I'm a fitness instructor. I do many things that I did even before I had glaucoma and continue to do, and even more fun things. So know that all of this management becomes part of your routine, not the center of your life. So if you've recently been diagnosed with glaucoma, I hope this episode helped give you a clearer idea of what might come next. So the most important things you can do are follow your doctor's guidance, keep your appointments, use the medication as prescribed, and take care of your mental well-being. You are not alone in this journey. And if this conversation helped you, consider following this podcast so you don't miss any future episodes of Field of Vision with me, Nikki D. So on our next episode, we are going to talk about blindness and glaucoma, because that's what a lot of people worry about if they are going to go blind because they have glaucoma. So thanks for joining, and I'll see you in the next episode.